Hey, what's up, everybody? It's Lee. This is my wife, Dr. Janet Cruz. She is a medical doctor. I'm only doing that to qualify it for the purpose of the video. We wanted to come on here and talk a little bit about COVID-19. We're getting a lot of questions from our friends and other family members, and we know that a lot of people are watching television news or a news feed, and we know there's a lot of conflicting reports, and we thought it might be cool just to come with a doctor who legit only cares about your health with nothing else in the way. So
no other agenda.
Yeah, no other agendas. And that's not a shot at the news or anything like that. There's just a lot of conflicting information. And we're going to do just a quick Q&A. I'm going to ask the question. She's going to give the answers and hopefully provide you with some just really good value about what's going on and how you can help or attack it or beat it, so forth and so on. Also, this video is meant to be shared. So if you have anyone you feel like would benefit from this information, feel free to share it wherever or however you want. We desperately want to help and make sure people are at ease. So I think the first thing we have to go into, Janet, with COVID-19, the first question is what are the basic things, and we've all kind of heard different things with this, what are the basic things everyone should be doing right now, whether you're a parent, an elderly person, or a young person? What are the things we have to do right now to combat COVID-19?
Sure. So I think the basic thing everyone should be doing is great hand washing, personal hygiene. So washing your hands with soap and water or using an alcohol-based, solution, especially throughout the day as you're touching surfaces that other people touch, doorknobs, remote controls, those sort of things. That's a big one. Don't touch your face. That is a challenge, can I tell you? Especially if you have young kids. Oh my goodness. We have a 3-year-old and a 6-year-old, and it is a challenge trying to get them to, one, wash their hands and then not touch their face. Those are the big ones. So with COVID-19, similarly to a cold and a flu, it's spread through droplets, right? So these droplets can stay in the air for about 2 hours. They can stay on surfaces for about 3 days. So again, if you're going out to the grocery store, if you're going out, to these public areas, wash your hands for sure. So wash your hands, don't touch your face. So those are the big ones that you can do right now. Now, the other piece of it is the social distancing, which really should be termed physical distancing. And we do that for a couple reasons. So one, if you are around someone that is potentially sick, right? If they sneeze in the vicinity, if you're about 6 feet away, you're probably safe from getting, this virus. The other thing is if you're sick yourself, making sure that you are covering your mouth, covering your coughs, covering your sneeze. You want to give a quick demo?
No.
How do you cover your sneeze?
Achoo!
Okay. The preferred also, if you have a tissue, cough into a tissue, sneeze into a tissue, then wash your hands after. So those are basics. So let me just kind of review. Wash your hands, don't touch your face, stay away from strangers. I guess that's an easy thing to say with kids. And then if you are sick, trying to stay away from others and coughing or covering your coughs and your sneeze. So those are the big things that you can do right now.
Right. So that confirms what a lot of us have heard, which is number one. I think that we need to talk about is why we have to do these things, because there's a lot of people out there that are, especially younger people, that kind of have the attitude of, well, I can beat this thing if I get it. It's really only affecting the elderly. But it's really a lot more to it than that, and there's a reason why we all, as a community, as a species, have to fight this thing. And Janet, one of the things you told me that I'd love for you to comment on, which freaked me out, this is really what woke me up to it, is that human beings do not have an immunity to COVID-19 like we do to other viruses and other diseases. Yeah, we don't have an immunity yet. Okay, and that's what freaked me out. Okay, so, and again, I'll let you explain this better than I'm about to, but the idea was that, if you're in the vicinity of somebody who has this, you're going to get it, and it's very easy to transmit to somebody else. That's why the hand washing, the quarantines are so important right now. Yeah. But can you jump into how our non-immunity to this is a really important thing, and why that's why everyone needs to take it seriously.
Right, and take those steps now together. Right. So one, I want to make sure that we dispel the myth that coronavirus is new. No, coronavirus is not a new thing. There is a different types of coronaviruses that circulate yearly throughout. Yeah. the big distinction with this one, and this is why it's called COVID-19, right? This is a virus that jumped from an animal model into humans, right? And now it's transmitted human to human. So our bodies haven't developed immunity to this particular virus. And this is what makes it, dangerous. Think about the big lines, right? When an iPhone comes out, all the huge lines, everybody wants that iPhone all at once. Think about it in reverse, right? So if all of us get sick all at once, it puts a huge, huge strain in the healthcare system. And we'll have to make difficult choices at that time, right? Who gets care, who doesn't. So that's why we're all taking these measures together all at once and now, right? To try to, slow the spread of this. So individuals that do get sick and they recover, perfect, they have immunity, right? So over time, yes, together we can get immunity to this virus as our bodies fight it off, hopefully, right? But if we all get sick at the same time, we could really tax the healthcare system. Really, we have limited resources. Even in a country where we may be rich in resources, it is very easy to tax that system. So this is why COVID-19 is just a little bit different than the viruses that we've seen so far. It could also cause very severe lung disease in people that are a little bit older. And you don't have to be that old. When you look at, some of the medical studies, like being a little bit above 40, having maybe blood pressure issues, maybe having, underlying lung issues puts people at risk for having these complications. So
and young people with asthma, we talked about that too.
Right, right.
If you're asthma and you're young, it's a problem if it attacks your lungs.
Right. So, with these sort of, with all of this going on, this is why we're all taking these steps together, right? We're all going to practice our hand hygiene, hand washing, et cetera, our social distancing together. And this is also why the federal government and other agencies have kind of stepped in. You'll see state governments, state officials, restricting classes. A lot of that is really aimed at preventing the spread and slowing down the spread so that we have time to catch up.
So I know that you mentioned this briefly, and it's what we're seeing in Italy right now is their healthcare system has been overrun, and they're having to turn away, you said this, they're having to turn away patients with other problems, and they simply cannot treat them right now. So again, if you're young and you feel like I can get this and beat it, remember, if this transmits to somebody else because of you, it could cause a much larger problem for everybody else and other people that have serious issues that need to be met. If our hospital people cannot get to those people, it's going to be a bad situation. So the next question I just want to ask you real quick is, and it's another obvious one, but I said this before, we're all getting phantom things right now, headaches, chills.
Yeah.
This is what happens whenever you start thinking about it. But what are the telltale signs that, something serious might be happening to you? B, and you're going to talk about this, why you should call, not go to the hospital or not go to the doctor right away if you're feeling these symptoms, and then what is the appropriate course of action if you are feeling a certain way?
Sure. So the biggest telltale signs of COVID-19 for patients, fever and dry cough are the initial presenting symptoms. People can get body aches, those sort of things. But then for a small subset of individuals, they could actually really develop shortness of breath. And that's kind of signs that things are getting a little bit more complicated. For people that are younger, the symptoms can be mild, kind of feel like a flu or a mild flu. For people that are a little bit older, they could be a little bit more severe. So for individuals that have maybe a fever, a dry cough, and things seem to be steady there and not progressing, you could stay home, take care of yourself just like you would with the flu. If you want to, seek the expertise of a doctor or a healthcare provider, call ahead. That's a big one, right? We don't want to spread it to other people. Call ahead, and you could get that advice over the phone in terms of where to go. Your physicians, whether they're primary care or urgent cares, a lot of us are really trying to switch over to telemedicine and do all these other kind of ways of delivering care so that we could get your answers, the answers you need. get you maybe like a local testing site if you need to go that route, or just maybe give you some information of how to take care of yourself, how to keep your family safe. All right, so if you're developing shortness of breath, that could be signs of things, moving in a little bit more serious direction. At that point, yes, call your doctor, or you might even have to go to the ER. If you have to go to the ER, the big thing is making sure that you are alerting the ER, making sure that maybe you wear a mask if you can. If you don't have a mask, a scarf or something covering your nose and mouth can kind of serve as a mask until you get there and get a proper surgical mask. So the big things, just take home points. Call first. That's a big one. For younger people, your symptoms can be milder. So if you do get, sick and you're deciding to stay home, making sure that you're isolating yourself from your family members, making sure that you're cleaning off items, like the big one, like if you use the bathroom, just wipe down the knob, wipe down the toilet handle, those sort of things to keep your family members sick, or not sick. Well,
you don't want them to be sick.
You don't want them to be sick.
Yeah.
And then if things are getting a little bit more complicated, yes, call ahead. If you need to go to the ER, go to the ER, but make sure you call ahead.
I know something that happens when I'm getting a cold is I say we go through the denial period of I'm not getting sick, and then you're sick. If you're in that period, I think I'm asking you, but quarantine yourself or put yourself, don't panic, number one. But if you're feeling like you're getting sick, take it somewhat seriously right now and put yourself at home and stay there. And as Janet said, and I'm, again, kind of reiterating what you said, it's very important you call the doctor right now. Don't just go to the ER unless it's a legit medical emergency, right? Yeah. Shortness of breath or something, because you can spread this thing very quickly in there. And you don't want to panic anybody, especially in your family and stuff like that, right? So the other thing I want to talk about too is that, Dwayne Johnson, The Rock, said something really prolific today. I really liked it, is that it doesn't really matter where this started, right? Because it's a human problem now. It's our species that's fighting it. And we'll have plenty of time when this is over to point fingers and figure that out. But we really got to fight this thing together right now. And that's something that really gave me a lot of hope. And, I've been saying too that if you only watch news and only go on Facebook or Instagram or whatever the social media platform is of your choice, you got to be careful, because you're going to go down a big rabbit hole of fear, all right? And it can really get you to a dark place. Don't be afraid to go outside, spend time with your family when appropriate, obviously, and, your immediate family I'm talking about right now. And look around the world. There are amazing people. There are amazing things going on. American companies are stepping up to help out other people. There's a lot of hope and a lot of good things happening in this darkness, if you want to call it that. You have to be able to see both sides. I know there's already been multiple times in the last week I've had to kind of get up from my computer and just leave the house or just go someplace else for a few minutes just to kind of reset my brain. It makes a huge difference. Unfortunately, she doesn't have the time to do that right now. But, you got to find these methods to kind of get through this. We're all going through this together. Before we close this out, first off, did you have anything else you wanted to go over?
Well, I think, this all can seem daunting. Take it a day at a time. Yeah. It's a small culture shift that we have to do. So for people that are dating, do the online dating for a while.
Yeah, it can be done.
It can be done. If you want to do, social things with your immediate family, you can go out, you can go hiking, you can, do a lot of these activities outside. So it does take a small part on our end, or small changes on our end, but it is absolutely doable, and we're all doing it together, right? We're all in it together. We're all, getting stir crazy together, and that's okay.
Yeah, so in closing, before Janet gives you some more resources of where you can go if you have any more questions, you can ask us questions by commenting below. Please keep them general. If you have specific medical questions, Janet cannot answer them online. But if you write comments and questions below, again, Janet will probably make another video with me. I want to thank you for taking the time to do this. She's been incredibly busy and nonstop since this started. But we want to be a resource for you. So feel free to write general questions below. Janet will get back to you if she can, or we'll make another video. If there's any questions I can answer, I will, or I'll just ask Janet. I also want to give a shout out to the people that still have to work right now. Obviously, anybody within healthcare, but also the people at the grocery stores, the mailmen and women, everyone that has to do these natural things to kind of keep the country going that we very much take for granted on a daily basis. If you're at the grocery store, thank the people at the grocery store for working that day. I'm not trying to tell you what to do, but they're putting themselves at risk legit now every single day so we can have food and basic necessities and keep things going at a normal pace. And again, just to reiterate what Janet said, these are just some basic questions and some basic steps of how we can move forward. The next few weeks are pretty crucial to our country beating this thing, and so we can get past it at a faster rate. And also, as I say, flatten that curve, which is super important. The healthcare system cannot be overrun. We all play a part, no matter how old you are or how young you are right now. It's very important that if you don't take these steps, you are definitely putting other people in harm, and you have to take this very seriously right now, but you should not panic. That is what I keep hearing from Janet is be serious, but we're not at a panic level yet. Everything we're doing is precautionary, and it may seem crazy, but it's supposed to be. It's not, that's how you keep ahead of something. If we're doing it with it, we're way too late, right?
So, and just to give you guys like resources, so CDC actually has really good resources. I actually find the local public health departments sometimes are a little bit more relative to kind of what's going on in your area. It gives you tons of information. If you do fall, ill, what things you could do to protect your family. Like, how do you clean stuff? So it does give you pretty good information. So I like those resources, that I've been sharing them with my patients, with my, family and friends. So, on my end, stay safe and keep each other well.
Yeah, again, thanks for you listening again. Feel free to share this with anybody you think would gain value in it. And once again, if you have any general questions about COVID-19 or just questions for the doctor, feel free to comment below with those, and Janet will get back to you if she can, or we'll just make another video and answer some of those questions. But until then, look, be safe, be smart, follow the guidelines, talk to people, call someone that needs to have a call, be there for each other. We're always preaching that now's actually the time we got to put it in. And remember, the world is going through something together right now, and I think it's really amazing when I see the people in Italy singing and doing dance concerts. I see American companies stopping production to make medical supplies. I see neighbors helping neighbors while staying 6 feet apart from each other. There's lots of things you can do. Do it, and let's get through this thing together, okay? Again, thank you so much for your time and watching this, and we'll see you again soon.